FSM for pain relief, how to get results. Hi, this is Dr. Harlan Mittag. In this video and video series, I'll introduce you to using frequency-specific microcurrent for pain relief. In part one of the videos, this series of videos, I'll focus on pain relief for pain arising from injuries. And in subsequent videos, I'll focus more on complex types of pain. FSM has generated a lot of excitement among health providers, particularly for its ability to relieve pain. Here are some quotes by some well-known doctors who are using FSM. Dr. Leon Chateau says, and I quote, "Until I personally experienced the rapid and remarkable pain-relieving effects of frequency-specific microcurrent, I was a skeptic." David Simmons, MD, author of the Trigger Point Manual, says, FSM is a whole new approach to the treatment of musculoskeletal pain patients that is far superior to any other treatment available. Neil Nathan, MD, author of Healing is Possible, says, I personally observed dozens of patients with cervical trauma, fibromyalgia, and shingles respond dramatically to this therapy. Here's some of the research that has emerged around FSM and pain relief. On the left, you see a study entitled Frequency-Specific Microcurrent as Adjunctive Therapy for 3 Wounded Warriors. This study documents the dramatic improvement of 3 soldiers who were suffering disabling chronic pain due to injuries that they had sustained in the line of duty. On the right, frequency-specific microcurrent resolves chronic pain and adhesions after ulnar transposition surgery. So this is a case study. A 19-year-old had surgery after injuring his elbow repeatedly, and the sequence of injuries resulted in scarring in the elbow, which was pulling on the ulnar nerve and causing pain, weakness, and restricted motion in his elbow. So the surgery was done to free the ulnar nerve and to reduce the pain. But the surgery had no benefit. And for the next 10 years, he experienced a lot of sensitivity in the elbow and ongoing elbow pain. He presented to an FSM practitioner who treated him twice, 2 treatments, 1 week apart. And the first treatment focused on reducing inflammation and irritation of the nerve. The second treatment focused on removing scar tissue that was constricting and pulling on the nerve. He had immediate relief, and a year later in follow-up, he had no pain, full range of motion in the elbow, and full strength in his arm and forearm. Another study on the left, the efficacy of frequency-specific microcurrent therapy on delayed onset muscle soreness. So this is weekend warrior syndrome. You go out, you overexercise, and then you can't move. You're hurting all over because your muscles are sore. So these researchers showed that FSM reduces muscle soreness after exercise. Then on the right, cytokine changes with microcurrent treatment of fibromyalgia associated with cervical spine trauma. This is a remarkable study that shows how a single frequency pair dramatically reduced inflammatory chemicals in the body while also dramatically reducing pain and also temporarily after each treatment raising cortisol levels. Cortisol is an anti-inflammatory, and also raising endorphins. Endorphins are a feel-good, pain-numbing hormone in the body. The study included 54 patients. 5 of the patients didn't tolerate treatment. The remaining 49 patients were each treated 3 treatments each, and 5 of those 49 patients had blood drawn before and after each of the 3 treatments. And in the patients who had their blood drawn, the researchers found dramatic drops in 4 inflammatory chemicals in the body an increase in cortisol, an increase in endorphins, while their pain levels dropped. The upper two graphs and the graph on the bottom left are the levels of interleukin-1, interleukin-6, and TNF-alpha, inflammatory chemicals in the body. And you can see how after each visit, or before and after each visit, the levels of these inflammatory chemicals dropped, and that the drop was progressive over the course of 3 treatments. In the bottom right, that's the drop in the reported pain that the people were experiencing. Here's a version of the visual analog scale that is used to assess pain intensity. At the beginning of this study, the average pain level for the participants was between 6 and 8.5. 6 is typically characterized as distressing, miserable pain. 8.5 is characterized as intense, dreadful, horrible pain. So that's the pain level that people were experiencing on average at the beginning of the study. This graph shows the drop in pain levels during each treatment. You can see that the pain level has dropped overall over the course of the 3 treatments. The top 2 graphs and the one on the bottom left are all the inflammatory chemicals that dropped over the course of 3 treatments. The pain score graph is on the bottom right. This is a record of the drop in a substance called substance P, which is a very inflammatory chemical that is secreted in the central nervous system. Let me just read you. Substance P is a neurotransmitter present in the brain and spinal cord where it is involved in pain signaling. Substance P facilitates the transmission of pain signals from the peripheral nervous system to the brain. In chronic pain states, elevated levels of substance P contribute to central sensitization, a condition where the nervous system becomes more responsive to pain stimuli. This amplification of pain signals means that even normally non-painful stimuli can be perceived as painful. In other words, substance P does enhance the effects of chronic pain. Beyond direct pain transmission, substance P can promote inflammation, which further sensitizes pain pathways. This inflammatory component is often linked to the persistence and intensity of chronic pain. So lowering substance P levels has dramatic impact, and there aren't drugs that are known to do this. On the top left is the graph of substance P, which I just showed you. To its right is a graph of cortisol levels measured before and after each of the treatments. And you can see that cortisol levels were increased by the treatment. And when it comes to pain and inflammation, we want cortisol to be higher because of its anti-inflammatory benefit. What you see is that cortisol rose after each treatment, but that the effect wasn't cumulative. The treatments boosted cortisol only temporarily. Then on the bottom, you see a graph for beta endorphins. Beta endorphins are produced in the brain, especially in the pituitary gland, and block sensation of pain. Endorphins generally elicit feelings of pleasure, euphoria, excitement, and well-being. Their release is facilitated by exercise. They create the experience of the runner's high. So red wine, chocolate, yoga, meditation, and other practices can also stimulate endorphin release, and the FSM treatments consistently raised beta endorphin levels. Here are 2 additional studies that show significant pain relief with FSM treatment. The first shows relief of low back pain, and the second shows relief of shingles. And I have seen dramatic relief of both low back pain and shingles pain in my clients with FSM treatments. The issue we face when treating pain with FSM is figuring out which protocol or protocols you have to use. And it would be nice if there was one protocol that worked for all types of pain, but there isn't one. The reason being that there are many different causes and types of pain. And to get effective relief requires using these specific protocols that target the issues in that type of pain being experienced. And in order to choose and use the right FSM protocols, some understanding of the causes of your own specific type of pain is important. That way you can choose the FSM protocols that are going to benefit you the most. Again, in order to treat pain with FSM, it's helpful to know where the pain is coming from and what's causing it. So let me show you some things that will be helpful to you as you use your FSM device to treat pain. Researchers now believe that there are three main types of pain. These are called nociceptive, neuropathic, and nociplastic. I'm going to read each of these descriptions and then explain them. Nociceptive pain occurs when there is an injury or tissue damage that causes inflammation. The image shows someone who has hit their finger with a hammer, causing pain. The finger is starting to swell, it's getting hot and red, and pain receptors in the finger are letting you know that there's an injury there. Nociceptive pain tends to be focused just in the area of injury. And nociceptive pain is usually described as sharp, aching, throbbing, burning, cramping, or stabbing. So nociceptive pain is a message saying that we've been injured and we need to attend to it. But as the body's healing response kicks in over days and weeks, nociceptive pain lessens as the tissue is repaired. Then we have neuropathic pain. There are specific nerves that carry pain signals from throughout the body to the brain, and it's only in the brain that we actually experience the pain. We tend to think of these nerves as electrical wires carrying a signal. There are a number of things that can go wrong with the wiring. The virus that causes chickenpox can also infect a nerve. When the shingles virus infects a peripheral nerve and travels through the nerve to the skin, we have an extremely painful condition called shingles. Shingles is a form of neuropathy. In diabetes, as another example, there can be damage to nerves because of high blood sugar and reduced blood flow. Diabetic neuropathy is the result. Diabetic neuropathy can be very painful. So anything that damages nerves can result in a neuropathy. It is damage to the wires that carry pain from the body to the brain. Then there is nociplastic pain. Pain is supposed to be the body's alarm system warning us of an injury. But imagine that the alarm system has gone haywire. Let's suppose that there was a real injury, let's say to your hand. So there was pain and the hand injured. But then after the hand completely healed, the alarm is still going off, meaning there's still continued pain in spite of the fact that the hand has healed and there's no chronic inflammation in the hand. This is what is sometimes called nociplastic pain. Nociplastic pain is pain that arises or is sustained by altered nociception despite the absence of tissue damage. In this video, which is part 1 of this series on using FSM for pain relief, I'm going to show you how to use FSM to treat just nociceptive pain, pain that comes directly from injuries. And I'll describe how to work with neuropathic and nociplastic pain in subsequent videos. An important point to make here is that there isn't always a clear delineation between these different types of pain. A person can experience a mix of different types of pain at the same time. So a complex pain syndrome can be a mix of nociceptive, neuropathic, and nociplastic pain. Let's take the example of a typical joint injury like an ankle sprain strain. This slide shows the difference between a strain, which is a muscle and tendon injury, and a sprain, which is a ligament injury. Most of the time, if you injure an ankle, your injury is going to involve both. You're going to injure the muscle, the tendon, and the tendons, and also the ligaments. So you want to treat both the sprain and the strain. After an injury, in this case a simple ankle sprain strain, the body reacts in a set way. These are the stages of healing of a simple injury. First, immediately following the injury, there's bleeding, then acute inflammation, then gradually over a period of days and weeks, there's repair, which is scar tissue formation. And finally, after the scar tissue formation has maximized, the body begins to rework the scar tissue, called remodeling of the scar. You can see that active bleeding lasts for just hours, active inflammation for a couple of days to several days, and then the first stage of scar tissue formation is over within the first 6 weeks. There are FSM programs for each of these stages of injury. These programs are classified as acute, subacute, or chronic, and are meant to be used during the specific time period to maximize the healing process during that phase of tissue healing. The goal of using FSM to heal an injury is to get complete healing. So this slide image is an attempt to depict full recovery from an injury. You start with healthy tissue, and suddenly then you have an injury like an ankle sprain strain, which sends your body into a repair cycle. The desired result is complete healing so that you end up with healthy tissue that is fully functional and causes no pain. If an injury fails to heal completely, we wind up with unhealthy tissue and often chronic pain as a result. The goal of using FSM to heal an injury, again, is to get complete healing. If that doesn't occur, if the healing is incomplete, then we enter or can enter a chronic pain cycle. Chronic pain is defined as pain that lasts for over 3 months by the Cleveland Clinic, and other authorities will say 6 months. But chronic pain initiates a self-perpetuating cycle, which you see here in the slide. So using our ankle sprain strain as an example, if healing is incomplete and pain continues beyond 3 months after the injury, then you enter this cycle. Beginning on top and moving clockwise, you see that pain can cause muscle guarding around the joint. This is the body's attempt to stabilize and protect the inflamed joint. The muscle guarding reduces the ankle's range of motion, and as a result of restricted movement, the muscles can be weakened, and this can further alter the motion of the joint, which then creates even more inflammation of the joint, chronic inflammation. The chronic pain is a source of constant emotional, mental, and psychological stress, and stress reduces the body's ability to heal tissue. And so the cycle perpetuates itself. To break the cycle, you need to deal with each component of the cycle. The pain, muscle guarding, and restricted mobility are addressed with FSM programs like these, ones that treat chronic joint inflammation, muscle hypertonicity, and problems with fascia. And for spinal pain, you would want to treat chronic pain in the spinal discs and joints. And you would also want to remove any scar tissue that is binding up the joint and preventing it from moving correctly. You would do that with one of the scar removal programs. If the muscles around the painful area have become weakened, you would strengthen them by treating the fascia and muscles, using protocols for myofascial pain, for muscle atrophy and circulation, and scarring, which has caused adhesions of nerves. In the healing process, scarring can cause adhesions of nerves. And this is scar tissue that has formed in the healing process and sticks to nerves and pulls on them, causing the muscles that are powered by those nerves to become weak. Finally, you want to use a protocol for cerebellum coordination. And this protocol helps to reset the cerebellum. The cerebellum is the part of the brain that coordinates movement of the muscles, and it can get out of sync with the injured area. If it doesn't get reset after a joint is healed, it can think that the joint is still injured and needs to be protected. It will continue to message the muscles around the joint to limit motion and to protect the joint. Using the FSM cerebellum protocol clears this old pattern of cerebellar instructions to the joint muscles, which are out of date and no longer needed. We tend to ignore the importance of stress management when it comes to healing. Stress throws a wrench into the healing process. When stress hormones are chronically high, this suppresses the healing processes that rebuild tissue. So it's both necessary and helpful to use stress-reducing protocols like the concussion protocol, relax and balance, and the vagus nerve stimulation to support the body's healing process. Let me summarize which FSM protocols you would use after an injury. Immediately following an injury, and for approximately the first 2 days, you should use the acute protocols. These are protocols that are going to have acute in the title, whether it's for a joint or a muscle. These acute protocols target active bleeding, pain, and inflammation. Then between 2 days and 6 weeks following an injury, you would use subacute protocols. Subacute protocols also target inflammation and pain, but at this point you should be seeing a reduction in the pain and swelling. Then 6 weeks beyond injury, if you're still having pain, you should use chronic pain protocols. So this would be chronic joint or chronic muscle or chronic myofascial protocols. And this is true even though the official definition of chronic pain is pain that has lasted 3 or more months. For the purposes of FSM protocols, at 6 weeks, you start using, quote, chronic protocols. At this point, you want to treat all aspects of the chronic pain cycle that I just went over. And at this point, you'll also begin removing scar tissue in the injured area. That's 6 weeks after the injury or beyond. In this video, I've talked about one type or source of pain, that is pain arising from injury. I spoke of using FSM protocols that support the healing process and used a sprained, strained ankle as an example. The same approach applies to any body area or structure that has suffered an injury. The goal is to support the body in finishing the healing process, resulting in a complete healing. We saw that chronic pain is the result of incomplete healing, and that chronic pain requires a much more involved use of FSM to target the different aspects of the chronic pain cycle. In the next video of this series, I'll talk about using FSM for the treatment of neuropathic pain and nociplastic pain. Thanks for watching.